Hi, everybody. Welcome to episode 28 of Ask Us Anything. I am Mark Raven from KaiNexus. We're joined by
Greg Jacobson from KaiNexus as well.
And, hello to the people who are tuning in and watching us instead of watching cable news. We know there's obviously a lot on people's minds other than continuous improvement. Greg introduced himself as Greg Jacobson. Some of you may know, and some of you might not know, he could introduce himself as Dr. Greg Jacobson, as in medical doctor. That's Greg's background. And maybe, Greg, before we get into some of these topics, I think we want to take advantage of Greg's experience and expertise. So we're going to ask him at least one question about coronavirus, and I think we'll take advantage of the opportunity here. If you in the audience have questions related to COVID-19/coronavirus, please enter those in the question box here in the GoToWebinar control panel. But Greg, quickly, I just want to tell the audience, about your background and what you're still even currently doing as a physician.
Yeah. I didn't say, but I am the co-founder and CEO of KaiNexus. My improvement story begins when I was finishing my emergency medicine residency at Vanderbilt, and I was handed Miyazaki Imai's book Kaizen, and that was kind of the beginning of this long journey that's resulted in founding KaiNexus and being where I am today. But from the point of graduating residency, I've been initially a full-time ER doctor, and then as KaiNexus has ramped up, I've still practiced. So I still do 2 24-hour shifts a month, and my wife is a full-time ER physician as well. And so naturally, I'm surrounded by medical knowledge, but I know that there's lots of people that don't have access to a physician. And so here at KaiNexus, we do a weekly meeting at 9 a.m. on Fridays where we just talk about the week and what we did the past week and what we did the future week. And over the last 2 weeks, a lot of that time has been dedicated towards kind of coming up with a plan at KaiNexus and then kind of synthesizing the information coming out, and also then just, the KaiNexians just asking, what would I do, or what are my opinions? And so we spent almost the entire time on that today, and just had a small percentage of that. So as Mark and I were about to prepare and preparing for this, we thought we had already prepared that the initial question was going to be, what are you doing? But then I thought there might be people on this that would rather not talk about some of the lean questions that we have. And if they wanted to ask an ER doc, then they can ask that. And if those questions die down, then we'll go right into the Ask Us Anything. But if those questions keep up, then we'll keep going as long as people have questions. I don't mind staying after the half hour. So having said all that, I think, I think we are at the precipice of a unprecedented event in the world. And by unprecedented, I mean unprecedented in people that are alive today. I think this is going to be comparable to the epidemic of 1918. And I think that the steps that we take today are going to seem extreme. We were talking about this at our 9 o'clock meeting, but I think in retrospect, I really hope that all the things we do today are looked at as extreme, because then I think it means that they actually worked, and the next several months aren't going to be as bad as they potentially could be. But I think it's pretty clear that we are dealing with a virus that has somewhere between 5 to 10 times the mortality rate of the flu. It's pretty clear that the older you are, the higher the mortality you have. It's pretty clear that it's a droplet-mediated disease. So this isn't something that's just in the air, floating around. It's not like someone can have COVID-19 disease and then you walk in 2 hours later into the room and breathe the air in and get it. This is something where someone needs to have it on their hands or sneeze, keeping in mind that when someone does sneeze, that the droplets, theoretically can go up to 10 feet away. But I think it's time for us as responsible citizens to start significantly limiting our social interaction. And so here at KaiNexus on Wednesday night, when kind of the story unfolded, we made the decision to become a virtual company, for instance. And so we are working from home indefinitely till this calms down. I imagine it's going to be at least a month. It might be longer. It might be 2 or even longer months, but however long it needs to be, we'll do that. We fortunately have a very easy decision to make, Mark. I mean, we can seamlessly continue our business at home. We have 2 offices. We have people that work remotely. I mean, you're in Florida a lot of the time, so between video conferencing and what we do, that was an easy decision. I don't know what I would do or how I would handle it if I had a factory or delivery or in-person services. Obviously, healthcare is going to have to just keep going on as needed. So the couple of things that I'll say, and then if you want to follow up with some of the questions, but I think the obvious things are we have to stop touching people when we're greeting them. So no more handshaking. I think you can just forego fist bumping. I mean, if you still want to do the elbow thing, I think that's perfectly fine. Certainly when you're out and about, you should be not touching. I think for a handle, you should figure out how to use your clothing or a rag or something along those lines. When you're hitting an elevator button, those things you can do with
knuckle.
Use your knuckles very easy. They say that the virus can live on droplets on surfaces. I'm reading about 12 hours now, but let's just say 24 hours. It's certainly not weeks to months. And it seems like metal surfaces contain the virus a little bit longer than other surfaces, if that's helpful. And we were talking, there were a couple of weddings that were going on with Kinexians in the next couple of weeks. And my approach is I wouldn't go to those. And I think that those are going to be canceled by the people having those weddings in the next couple of days. I mean, just in the last 24 hours, our schools were canceled. We were going to go to Disney World for spring break. They closed Disney World. So I think we're going to see more and more of that. I'm really glad to see all the different institutions and companies taking a really proactive approach. I'm surprised that there hasn't been more countywide and statewide and federal things going on, but that's neither here nor there. I think NBA and all the sporting events, and we're going to go see a play this weekend. So my approach would be just stay at home. There's certainly no reason not to go out and about. You can take walks. You're not going to get the disease by going out and around. I think you could even meet individual people. I just wouldn't do it at a social place. And when I would be talking with them, I wouldn't shake their hands. Obviously, if you're sick, definitely stay home. There's no question about that.
Right.
Now, briefly on testing. Please do not go to the ER or do not go to your doctor if you have anything that resembles a cold. I think the only time I would be engaging with the emergency department or your doctor is if you are really struggling to breathe, if you're having problems breathing, certainly if you're old and have problems or other medical problems. I think that there's going to be decentralized testing that's going to be set up here in the next couple of weeks, and I think that will be the way the majority of us will get tested to see if we have COVID-19. It looks like about a third to half of the population is going to get it. There's going to be just a tiny percent of people that are going to get super sick. But obviously, when you're talking about half of the population and a tiny percent, it's going to be pretty devastating for the country in general.
Yeah. So a couple of follow-up questions. So you mentioned limiting social interaction. So like, for example, and you talk about no risk from, let's say, if I'm going to go outside here in downtown Orlando and go take a walk and get some exercise around the lake, like walking through the park, not being in close proximity to people, not touching anything, safe to do. I'd probably avoid going upstairs into the building's gym, even if I were to wipe down equipment. There's more risk of something being on the surface from somebody else who was previously up there, for example.
Absolutely. Right? And I think, you can get a great workout at home. I'm unfortunately recovering from an ACL surgery, and I've got those bands that are part of the rehab, and I'm just amazed at between, planks and squats and the bands. I mean, I am in full-blown sweats when I'm done with the workout. So yeah, So figure out how to do your workouts at home. And then when you're out and about, with the air moving around, it's actually probably even better than being inside with someone that would have. If you're inside, no one has the virus, then that's fine. But yeah,
Right.
short of someone sneezing on you or coughing on you when you were out and about walking around, you're perfectly safe going outside.
Yeah. And then your recommendations, and I think even what I've read about CDC recommendations, there are different recommendations if you are 60 and older in terms of really being more cautious about only going out if it's really necessary and asking yourself that, is this necessary? Right?
I mean, the data that I've seen, and this isn't from the medical literature because there just hasn't been a lot from the medical literature that's gone in. So this is just from lay articles. Now, I did listen into, we have a good educational group called MRAP that has been doing emergency medicine education since I was in residency, so 15, 20 years ago. And they did a discussion with a triple boarded ER doctor. So he has ER, internal medicine, and infectious disease, and they spoke for about an hour. And so some of the stuff I'm telling you is from that, but otherwise the mortality that I saw was about a 15% mortality if you're over, I think 70 or 80. I think if you're over 60, it's about an 8% mortality. And then as soon as you go less than 60, it just plummets. So you're in your 20s, 30s, 40s, 50s, essentially. You're looking at something that's probably going to look like a really bad flu would be the way I would think about it. And I think the biggest thing to keep in mind is that more people are dying every day and will die every day from car crashes throughout this entire pandemic than will die from, well, I mean, depends. We'll see how it goes, but theoretically. So this isn't like hysteria. This is just, let's be cognizant of what's happening, and we can all do our part in limiting its spread and kind of flattening out the curve, as people are mentioning. And so I think that's a very appropriate kind of measured response.
Right. Yeah, we've got a couple of questions, and then the question I'll take third is actually kind of something I can also talk to related to working from home and what are we going to do about continuous improvement. But one thing. Well, here I'll just say the question. There's one question here, Ken, from Eric. I want to be careful about rumors, but Greg, maybe you can talk to science or the reporting around this. That there's a rumor that the virus has gone airborne. Have you heard anything about that? That would make a big difference, right?
I have not heard anything about that, and as far as I know from the sources I've seen, it's droplet. It's not airborne.
That droplets would normally fall to the ground if they don't land on somebody, right?
Exactly. Yep. So droplets, like if you sneeze, kind of the rule of thumb is those droplets have the potential of going up to about 10 feet. They're going to fall to the ground, and so then any of the surfaces. Obviously, if someone sneezes on you, but whatever surfaces those droplets land on are the ones that one should be concerned about. Now, I've read a bunch of lay material, and I have no idea if these things are factual, but some of them make sense. That if you drink and the virus is in your mouth, then you'll flush down into your stomach, and you it's not going to go into your lung. So I don't think that is a rumor that would be bad to spread, because drinking fluids is probably a good thing. So there doesn't seem to be any harm in that.
Yeah.
Helpful.
Okay.
But yes,
another question.
The follow-up of that would be a big difference. Yes, that would definitely be a big difference. If it's airborne, then the easiest disease to think about it is that it's more like measles. And then if you go into a room that someone was in prior that had the disease, then you could get infected from the virus. So yes, I've heard nothing credible that says this is airborne.
Okay. I have another question here, and we know public schools are being closed in many states, many cities. But the question asks, if public schools are open, should I keep sending my child?
I think it's literally a decision that you're only going to be making for a day or two, because I'd be very surprised if public schools are going to be open for very much longer. So I guess the question directly today, I was planning on taking my daughter to school. I think by Monday I would have been very surprised. I mean, I texted, I didn't text, I emailed our principal last night and I said, because he's been contacting my wife, and I said, I would be very surprised. To me, it's not if schools are going to close, it's just when they're going to close. So, and I just want to reemphasize that the reason that schools and all these events need to shut down is because it's going to decrease the speed of the spread of the virus. So it appears that children are not significantly affected by the virus. They don't have, they're, I mean, I think they're getting ill, but they're not having significant mortality, thank God. And there's some of the theories behind that are that they've recently had coronavirus colds, and so there might be some cross immunity for that. And there might be also anatomical or other biologic reasons that we just don't know yet. But I think if it's not difficult for you to have your child at home, that just makes sense. I think closing schools becomes tricky because the schools for a lot of our population. So from an epidemiologic, like I always like to think from an epidemiologic standpoint, I would practice medicine one way, but then when I'm looking at a patient, sometimes I practice it a different way. So like when I'm with a patient, I'm thinking, what would I do if this is my brother or my father or my daughter or whatnot? And when I'm thinking epidemiologically, I'm kind of thinking, oh, well, we probably shouldn't test, and we're over testing and things of that nature. So from the standpoint of the epidemiologic decision or the kind of the global decision, a lot of kids get social support from their schools. They get 2 meals and they get a place where they feel safe and whatnot. So I'm glad I'm not needing to be part of making those decisions, but I think based on the speed at which things have closed over the last several days, I think that all schools, I think we're heading towards kind of like let's just all stay home as much as possible for the next month or two. Yeah, there'll be some economic consequences, but that's all going to recover. I mean, there's nothing fundamentally happening to business that would make me think from a business standpoint that like value is, escaping from these businesses and there's fundamental changes. I guess if we're starting to deal with coronavirus in perpetuity, but I'm sure we'll adapt to that as well if that's the case. But there's no indication that would happen.
Yeah. Well, and something you said in our KaiNexus company meeting earlier regarding children is that, I've seen reports that the coronavirus seems to not be affecting children, but the risk is that the children are asymptomatic and spreading the virus, and then children bring the virus home to, let's say, a grandparent or to a parent who has an underlying health condition that puts them at greater risk. Thinking of the children as a vector for spread is the argument for shutting down schools, right?
Yep. So, for example, my father had his hip replaced earlier in the week prior to this kind of explosion. And I was down in San Antonio working remotely, helping out there. And I did not go visit my 94-year-old grandmother during that time. She's just going to have to go visit without seeing me. And so those are the kind of decisions, I was making because, I could have been a vector. I worked in ER shift a couple of days before. I was asymptomatic. I mean, obviously, I didn't see anybody that was at risk, but people are asymptomatic for some period of time. So there was another question around Seattle. Was that?
Yeah. Well, there was another question I was going to ask first because it's something I thought about and was researching. We mentioned business impact. Many businesses, especially local businesses, restaurants and the arts, and they will have this will be quite a whammy if they have limited or no revenue for a month or two. So, I've done a little research this morning, and I'm curious your thoughts of, risk of going to a restaurant, risk, and thinking through in terms of risk to yourself versus, again, this question of epidemiological public health risk of potential spread and how do you weigh those pros and cons? Or where do you, this comes back to the balance between limiting social interaction versus eliminating it altogether. What are your thoughts about, like, is it is it creating unnecessary risk in one dimension or another to go and eat at a restaurant?
I haven't had any meaningful discussion about this or read about it, so I don't know if I'm an expert by any means, and so you can take my opinion with a grain of salt, but I don't think I'm going to be too interested in going to eat at a restaurant right now. So the way I look at it is I've got a bunch of food at home. I can, nourish myself at home, and I'm not going to risk getting exposed to corona, or if I have it, spreading it to someone else. That's going to be my approach. I'll answer it that way. That's going to be my approach.
Yeah, and what I read this morning, are comments from physicians and public health experts. At least, the article I read, and again, this is I'm trying to pass along, like others said, this is not my own independent scientific knowledge. That if you go to a restaurant, you really do want to be mindful of hand hygiene. If you have hand sanitizer, I know in general restaurant menus tend to be unfortunately dirty. So if you're handling a menu and you order, it's probably a good idea to go to the bathroom and use soap and water. And that's something I think has been forgotten. Like people say, oh, I can't buy hand sanitizer. Regular old soap and water. It doesn't need to be antibacterial soap. Regular soap, I'll ask you to comment. Regular soap has a great effect in breaking down virus if you happen to have it on your hands, correct?
Yeah, absolutely. I mean, all soap is antibacterial. So, yeah, no question that 20 seconds of hand washing is, from my understanding, more effective than the hand sanitizer. I think the hand sanitizer is more convenient and you'll do it more. And so in that way, it should be used in addition to. But I'm just trying to make it. Anytime I walk by a sink now, I'm just like, when I'm in the kitchen, I wash. Even though there's no chance that I would have gotten anything, I'm just trying to become more cognizant of that. And we talk about not touching our faces. I know just in this talk, I probably touched my face like 8 times, and it's just such a common thing. But the more we can, there's no way we're going to change that habit unless the first step is just being cognizant that we're doing it, and then the next step would be like, oh, maybe that this is where we can get into Atomic Habits and James Clear and things like that. But anyway.
Well, I mean, changing habits is difficult. I'm trying not to touch my face. I'm trying to ignore an occasional itch. I'm failing. So I had to go to the doctor this morning. I follow up for a nerve issue. The doctor came in and stuck his hand out like he was going to shake my hand. And I was like, okay, well, no, let's not do that. I started to offer an elbow bump, and then he was like, okay, well, let's just skip that too. Like, okay, fair enough. But like these social habits are really, really, really hard to break. But back to the restaurant for a minute, and we'll take. There's a good question from Laurel here. The other thing I read this morning was that, well, like if you look in Italy, they are leaving restaurants open, but you want to be spaced out, and you don't want to be sitting voluntarily next to somebody who is coughing or sneezing. Hopefully, those people are staying home. So be mindful of that. But one thing I think is maybe good, I thought a clever recommendation, if you want to support a local restaurant or a theater or someplace that may be hurting in the short term, and you have disposable income that you would have otherwise gone out and spend, buy a gift certificate. Especially if you buy it directly from a restaurant and give them your credit card through a website. They are getting that money now, where then you can go then get the meal later. That may be one way of making a gesture, or maybe that's a helpful financial lifeline, one way of trying to support a business rather than actually going out.
I love that. I hadn't thought of that.
So question from Laurel here. I'm interested in how people are doing facilitation or training work around physical flow in a remote environment. In Seattle, we will likely not be able to meet in person for the next 6 weeks, and we don't want to cancel everything we had planned. So let's just speak to that maybe for a minute as a consultant. I was on the road this past week with a health system client. I flew home last night. And the decision hasn't been 100% finalized, but we are all fully expecting to not be traveling again next week because the health system, I think, and I don't know if this question is from a person in healthcare or not. Maybe you can follow up, Laurel. But, for one, I think the health system client needs to focus on first things first. And even though they're trying to apply lean thinking to their design of processes around COVID-19, some continuous improvement work is going to be put on hold. And secondly, I think understandably so, they do not want unnecessary foot traffic into the hospital, which I appreciate and I understand. So part of my answer to Laurel is I think, even though I think it's a reality that some continuous improvement work will be postponed, I think there are opportunities, and the other consultants and I are working with our client to figure out how can we support them remotely. There are certain things that can be done through phone calls, video conference, probably not full-blown improvement activity, but if someone wants help, I think, coaching through an A3 through a live phone call and or a web meeting is one way to provide support for problem solving. I probably wouldn't try, like if somebody were trying to do a Kaizen event, I would probably just postpone that and say, let's wait until we can all be together in the Gemba. There might be an opportunity, to redouble efforts. Training is not the end all be all of continuous improvement, but there is a time and a place for that. So can you do web-based presentations? Can you do book club discussions? Are there things that you can do to further knowledge that you would then apply through practice once things get back to normal? That's one thought. Greg, you've got, there's some things that we're doing as a KaiNexus team that you might want to share.
Yeah, I mean, we're certainly we're working from home, but we do a lot of video conferencing in general. So we're going to try to turn our video cameras on a lot more over the next month or two, because it really, you get almost 90% of the experience of being in the same room, in my opinion, with the video camera on. And we're trying to be a little more proactive about putting what we're doing on our calendars, and then just also picking up the phone and talking to people. I'd be remiss to say that I think our customers that are, fully deployed on KaiNexus or thinking, not that I want KaiNexus to, flourish at the expense of this crisis, but I think places that have moved off of paper and physical bulletin boards are going to have an easier time doing either asynchronous or synchronous communication through KaiNexus. So certainly it's a plug to move some of this work into the cloud, and we're really fortunate. But a number of our companies, a number of our customers are customers that they're companies that you've heard of in the news recently that are really on the front lines of either developing tests or drugs or materials, or obviously delivering the healthcare. And so we're honored that we're already part of their improvement culture and helping facilitate that. And we're going to be able to help facilitate that, whether people are working from home or not. I do agree though, like when you're talking about flow and you're you need to be on the shop floor, that might be a little challenging. And it's something that I don't anticipate that this is going to be the new normal. I think that this is going to be, a month or two of significant disruption. Unfortunately, there are going to be people that are going to have serious medical problems during this time, and that's
yeah.
That's
so, and I think in general, my advice, let's say the KaiNexus customers who use our system, they upload an A3 in support of improvement work. I think even if you're using our system as a repository, I still think it's the most effective thing to actually work on and talk about an A3 in person. I think second best would be in an interactive way, like a phone call or a web meeting. I think the least effective thing in general is to either just upload a file and say, hey, everybody comment, or hey, I've emailed you a file. Send it, like, the practice, and I've learned, I was fortunate to learned some of this directly from John Shook at the Lean Enterprise Institute, who quite literally wrote one of the books anyway on A3 problem solving. And John Shook always emphasized, as he says, it takes two, or at least two, it takes two to A3, that the document is something that helps prompt discussion. And that interactive discussion, I think, is best. If all you can do is asynchronous, then that's probably better than nothing. But I still think doing something that's real live interaction is the most constructive way to move things forward and to get input and insight from people. So we don't have any other questions from the audience. We appreciate it. Looks like most everyone has stayed on for the conversation here. We will, of course, archive the recording of this. We'll post it on our YouTube channel. The audio will be on our podcast feed. And if you want to share some of this with others, Greg, partly to yourself and to others, I want to share gratitude to people who are working on the front lines of healthcare, you, your wife, the nurses, the doctors, the people who are coming in contact with patients, because it is similar to firefighters running toward a fire instead of running away, or Marines talk about running to the sound of trouble instead of running away from it. With this virus, unfortunately, it is putting healthcare workers at risk. So I appreciate everybody who is willing to do that. I really do.
Thank you. I feel like of all 20% of the workforce, something being involved in healthcare, I'm on the very end of the spectrum, just working a couple days a month. There are people that are literally on the front lines 24/7. I think our infectious disease doctors, all the administration that's having to put in protocols, and countless other people are doing infinitely more than I am. So,
well, thanks again to everybody who is doing that. And in general, I think experts recommend, if you have other questions, the Centers for Disease Control and Prevention website, cdc.gov is probably a good source. I think there's always risk in times like this. There's risk in general of bad information circulating around social media. Like, for example, the one thing that was being passed around is saying, well, you can make your own hand sanitizer by taking vodka and aloe gel. And then, people point out the reality is that vodka generally is at 40% alcohol. That's not strong enough to really serve as an effective disinfectant. And so I think we have to be careful about believing anything that's out there. Be careful if we're sharing something on social media that it's valid information. And I don't mean to scold anybody, but I think it's something we're only doing. I worry if I'm posting something. Okay, is this accurate? Is this the most up-to-date information? Greg, thoughts on
what's the, if it's incorrect, what are the consequences of being wrong? Like, for example, if drinking proves not to help, whether or not you drinking non-alcoholic beverages, speaking about the fact that you just talked about vodka, if that's found to not help, well, there's really very little harm in taking a sip of water every 5 to 10 minutes. Certainly there's harm in, I think I'm desanitizing my hands, or I am sanitizing my hands when you're not. So I think always thinking of the consequences of if this is incorrect is important to note.
Right.
There was something that my mom told me, like, if you exhale for 10 seconds or something when you wake up, or if you're able to hold your breath for 10 seconds, and it's like, I have no idea that's, there's any evidence that that's the case, but
as a test of doing that is what, a test of lung function?
Yeah, lung function, and see if you have like early fibrosis from the virus, but there's probably zero harm in doing that. So it's like, if you want to do that when you wake up, then go for it. Make sure you're sitting down and you're not going to pass out and like get a head injury and then have to go to the ER for that.
Right. Yeah, and then maybe one other thing I'd add about hand washing. The guidance I've heard, it says, wet your hands and then really do lather for a full 20 seconds. And that includes the back of your hands, your fingertips, making sure that, you're following good standard work. Well, I think that's better than taking a little squirt of sanitizer and splash, splash. I mean, like, kind of going about it the right way and not going through the motions is probably even more helpful.
Well, we might need to schedule another one of these sooner rather than later, Mark. One, because maybe the COVID-19 information is rapidly evolving, but then two, because we didn't get to very many of the real questions. But
we still have other, yeah.
Yeah, I think this was timely and hopefully valuable to folks. So.
Okay. Well, thank you for suggesting that we sort of end up shifting the format today. Apologies to people who are looking for something to get their mind off of what's going on. But it's like a lot of people voted with their feet, so to speak, by staying connected to the webinar. So with that, please do stay tuned to kinexus.com/webinars, where we announce future webinars, future Ask Us Anythings. Well, thank you for tuning in. Greg, thank you for sharing some thoughts today. Thanks everyone for your questions.
Thanks, Mark. Talk to y'all soon.